Hi, my name is Savannah Bigelow, and I am doing my project on opioid waste in Ohio. A little bit of background about opioids is that it is a chronic condition, and it affects people's emotional health, and it's an economical problem. People typically do. People usually use opioids to help relieve a feeling of pressure or to reduce pain that they might be having. Commonly used opioids are fentanyl, methadone, and oxycodone. So the mortality rate in Ohio is anywhere from the ages of 25 to 54. You typically see it in white males more often than any other race or gender. The targeted areas for Ohio are Columbus, Cleveland, and Cincinnati. The overdoses that are happening more frequently or not are all linked to disorders of cardiovascular, anxiety, and of course the abuse. Typically, people that overdose from them have some kind of prior abuse to opioids. So Narcan is used to help bring people back from an overdose. There's a study from Marco that I found on emergency room departments using Narcan. 8 to 9 patients, which was their 90%, accidentally overdosed. 70% of them were reported to have past history of using opioids. And 31% of that total number had some kind of access outside of the hospital to Narcan. The conclusions that came from the study, Marco, showed that patients required such a higher dose each time of using Narcan than prior before. The more times they came in, the higher Narcan dose that they had to give them. Let's see. And then fentanyl is one of the hugest most common drugs in Ohio. Fentanyl has become a major driver in opioid mortality since 2016. In 2016, Ohio experienced 421 deaths of fentanyl. There was a study from Dino that I found that showed that people using fentanyl were anywhere from the ages of 35 to 64. And again, they were white males, which I find really interesting that most of these overdoses they're coming from white males. It's very fascinating, and it's older, not really younger generations. The toxinologist reported that Narcan was given upon overdose, and each death had a history of controlled substance in this article. So when they did the autopsy on the opioid overdoses, that it showed that there was Narcan already in their system, and some kind of opioid also was in their system. So weird. A major disorder that we see in people that are abusing drugs are PTSD and a depression disorder. Typically, it's the people that are depressed and have some kind of past event that they just can't figure out how to cope with yet. These people just want to have a sense of pressure again, and just to kind of feel empty inside, because like I said, they just don't know how to cope with whatever previously happened in their life or is currently happening. They have no kind of support system. Characteristics. I found a really interesting article by Sweeney on characteristics of people that typically use opioids. These typical characteristics are, again, depression disorder. They've had prior suicide attempts, They have some kind of behavioral health issue, never married, they own firearms, which is really scary to think about, and again, they are older white males, and this article showed that they were living in more like urban areas. So here I have a grid that my group and myself made for testing the solutions. Our scale was ranked 1 to 3, 1 not a problem, 2 as neutral, and 3 as a problem. So our first solution is prescription drug monitoring. For feasible and potential negative consequences in time, we ranked them as neutral. I don't feel like they would really be much of a problem. It's not really time consuming. You can get in and out. The major problem with this one, I figured, is cost, because as we all know, drugs are highly expensive, and I don't honestly know how some people afford them. The second solution that we came up with was improving drug awareness and side effects. We didn't really see an overall problem with this one. We put public acceptance, effectiveness, and resources and times all as a neutral, because it could kind of swing either one way or the other if it would be a problem. But overall, I think that improving drug awareness and side effects could really help the community and less using opioids. Solution 3 is weekly drug testing based on a color coding system, which allows you to see if they should come in less or if they should come in more. We found this one to be more probabilistic. It really sounds like a good idea, though. I think that it could be very beneficial in the environment, in the world. It's just kind of got a lot of kinks in it that, us as people would have to figure out. We figured that, one, it would probably cost a lot of money to get different color coding tests and things like that at first. And the resources, of course, because you have to buy all the testing and the dye, and depending on the people, and if you can get them to come in less, then it'd be less expensive, but then you might get a whole new bunch. So it is kind of a little expensive, a little bit of a problem. And then our fourth and final solution is to seek therapy for underlying mental health issues. No really problem here besides the resources available, because you have to have those therapists and those trained people to help and take the time for the mental health patients. The cost and the effectiveness and the time really wouldn't, I feel like, could it swing one way or the other, like especially with the time, because sometimes therapy can be a little expensive, but it's very beneficial. So I'm not sure how accepting the public health would be on that, because some people really just don't want to take the time to do it. And then I feel like if they had more resources and more support, they would willingly want to do it more. And then I have my resources finally here. I found 3 articles. The first one is by Anderson, and it is linked to patients that have reoccurring addictions, post PTSD, and major depression. My second article here is by Dino, and it just shows how fentanyl is an opioid epidemic, and it targeted Chattanooga County and Ohio specifically, this article did. And my third resource is by Marco, and that was the use of a Narcan study trial in an emergency department. I had more, just kidding. My fourth article was by Parks, and Parks showed analysis of opioid poisoning mortality targeted in Ohio anywhere from 2010 to 2016. And the fifth one was by Sweeney, and it showed suicide in older adults in Ohio, specifically showing the mental health services, characteristics, and prescriptions. And that's it. Thank you for watching my video and listening. I appreciate it.